front of me here. So we want to welcome you to our first virtual support group meeting of the Columbia Parkinson's Support Group. We are looking forward to getting to know you all. We hope we have people from all over. If you're on the live presentation, we'd love for you to put your name in the comments and where you're from, so we just know who you are and where we're reaching out to you from across the country. That's possible. And also, we'd love to stay in touch with you. We're not going to bother you or give your information to anyone who's not supposed to have your information. We just want you to know what's going on with us, to keep you updated about information that is happening within our group, new information that we're getting from our different partners in Parkinson's. And so it's just a way for us to share information with you. And so forgive me, we're still kind of working out some kinks in the technology here. If you're on the live presentation, we are going to ask you that if you cannot hear us talking during this slide, so you should be seeing a red slide on your screen, and if you cannot hear us talking during this slide, then you might have to get on your phone. Stay on your computer because you're going to want to see the slides that are presented. But Zoom has assigned some phone numbers for this presentation, so if you're not able to hear us on this slide, then we are going to want you to dial into one of these phone numbers based on the location that's close to you. So if you're in South Carolina, then you're going to want to dial into that very first one, the New York one, because that's closest to us. And then at the very bottom, you'll see the meeting ID. So if you dial in, you're going to see this meeting ID, and I don't have a pointer here to show, but the password is down there at the bottom as well. So we're going to kind of pause here for a second and let anybody who needs to dial in do that, and then we'll pick right back up in about 30 seconds.
As somebody that's somebody's viewing the video, you can have them see you, or you can have them. No, I don't.
Okay, so hopefully those who were not able to hear us on this red slide have had a chance to dial in. So we're going to move on to the next slide. So a couple of things about Zoom. So we hope that y'all found it easy to log in with us. In the bottom left-hand corner of your screen, you're going to see a mute button. If you could please mute your line so that we don't get interference from background noise during the presentation. If you are not muted, there is the chance that we would be able to hear you. So I'm sure as you've been buzzing around the internet, you've heard some fun stories about what happens on Zoom. So we just want everybody to be muted so that we don't have a fun story to tell after this is over. And then also there's a stop video and start videos button. So we'd love to see you, but you might want to stop your video just in case. Hopefully as we go forward, and if we are able to do more presentations by Zoom, you'll at least have a little bit of understanding of how those controls work and what they can do. If you do have questions during the presentation, I do believe that Mike is sort of my wingman today. He's manning the chat. So if you have questions, feel free to ask at the end of the presentation. We will try to address those questions as best as possible. So if you have not been familiar with the Columbia Parkinson's Support Group, we wanted to give you a little information about ourselves. So we are a group of volunteers, and we are of various walks of life. Our volunteers consist of people with Parkinson's, caregivers and care partners of people with Parkinson's, and people who have an interest in and support Parkinson's disease. So our officers and our board members, we're all volunteers, and we don't receive any compensation for any of our time that we put into the operation and carrying out of the group. We're also known as, sometimes you might see us out on Facebook as CPSG. We're a nonprofit organization, and we operate out of the state of South Carolina. And our mission is to provide the Parkinson's community with a safe environment to obtain support, information, and education to create awareness about Parkinson's disease and fundraise for further research for the cure of Parkinson's disease. And our definition of the Parkinson's community can consist of people with Parkinson's, their caregivers and care partners, family members, friends, and any others who are working in related fields or have an interest in Parkinson's disease. So that's a long way to say that everyone is welcome to participate in our group at any time. And anybody who has any sort of interest in learning more is more than welcome to attend any of our activities and events that we hold. Also, at the end of this presentation, sometime today, you will have a survey coming to your email box. So we want your feedback so that we can know how the Zoom presentation went for you. And what we will want to know is we will want to know how easy it was for you to log on to, Zoom, how easy it was for you to navigate through, how you could hear us, how well you could see us, and how well you could see the information presented on the screen. So we're going to pause here for just 1 second. I've got a few people who are messaging me who are letting me know that they're having some trouble getting logged in. So I want to give them the opportunity to get hooked in with us here. So if we can just take 1 second to do that, and I'll be right back with you in about 30 seconds.
I'm supposed to have somebody speaking about swallowing. We're good to get this far. This is my first time. Let's see if I can get rid of her. I don't guess so. She's got to get rid of herself.
She just figured out that everybody was looking at her nose.
Okay, so we are going to move forward through our presentation. Thank you all for being patient as we work out some technical glitches here. As this is our first virtual support group meeting through Zoom, so we are working to try to get any glitches out. So thank you for your patience on that. What we're going to be discussing today is speech and swallowing programs for Parkinson's disease and letting you know what's so important. So we want to make sure that you have the information that you need to make good decisions about speech therapy and swallowing programs. And we want to provide you with as much information as you can get to be able to understand and have a good understanding of what is out there for you. So my name is Joy Kinney, and I'm a speech language pathologist. So this is a little about me. I have a Bachelor of Arts degree in speech language pathology from Columbia College here in Columbia, South Carolina. I have a Master of Science in Rehabilitation with Communication Sciences and Disorders from the Medical University of South Carolina. And if that wasn't a mouthful, I also have a Certificate of Clinical Competence in Speech Language Pathology from the American Speech Language and Hearing Association. So that's a mouthful. It's a lot of letters. And there's not a test on that. Y'all don't have to remember the letters behind my name at the end of this. I'm currently employed at Carolina Health and Hearing on Lee Park Road here in West Columbia. And there's my email address down there at the bottom, as well as a phone number to our office. So if you have questions or you think of questions later on after this presentation, you are more than welcome to email me or give me a call here at the office so that we can make sure that we get your questions answered as best as possible. I should also say that I'm not receiving any compensation for this presentation today. This is part of my volunteer work as the chairperson for public relations and media relations and all things getting the word out for the Columbia Parkinson Support Group. And so with that, I do have to disclose that I'm not receiving any financial compensation for this presentation today. What I'm going to talk about today is a lot of different things, a lot of different aspects that impact someone with Parkinson's. These are all of the different things that could play an impact of someone who is having difficulty communicating. So of course, we're going to talk about hearing and how hearing is impacted by Parkinson's. We're going to touch on some speech therapy treatment programs for Parkinson's. We're going to talk about exercise in speech therapy and the benefits of exercise and the risks of lack of exercise. We're going to talk about what exercise is most effective and when is it the right time to start speech therapy exercises. We're going to talk about what your insurance covers. And then at the very end, I'm going to tell you about how I became everyone's favorite speech therapist and how to find your own favorite speech therapist. So I need to let you know as well that I am not certified in LSVT, Speak Out, or any other treatment program that's typically recommended for someone with Parkinson's. I have a very different approach in my clinical practice, and so I have not pursued certification in those areas. So I feel like with that, I can give you a more objective opinion here. And of course, everything that's in this presentation is my clinical opinion. However, I do base my opinion in research, and you'll hear some of the research that where I get my opinions from. I do treat people with Parkinson's in my line of work, but that's not the only diagnosis that I see. And I'll talk at the end about how my therapy sessions work. First, we're going to talk about how hearing is impacted by Parkinson's. And what we know is that there's not a lot of specific research available on this issue. What we want to consider, though, is that hearing impairment can be caused by a number of different factors, including medications, age, noise exposure, diseases and genetic syndromes, and lifestyle, such as alcohol and drug use or abuse. And you can see all the different factors that go into each of those different areas that impact hearing. One common complaint that we hear frequently here in the office, so here in our office, I am the speech therapist here, but we also have audiologists that evaluate and treat hearing deficits. And one common complaint that we hear for people who have Parkinson's is that their loved one or their care partner comes with them and says the person with Parkinson's just doesn't talk very loud anymore. So we have to consider that maybe that is true, but maybe it's not. So we have to consider that maybe the loved one or the care partner has hearing loss and cannot hear the person that they are caring for when they're trying to communicate their wants and needs. Or maybe it's both. Maybe the person with Parkinson's just doesn't talk very loud anymore as a result of the effect of Parkinson's, and there is the possibility that the loved one or the care partner also has hearing loss. And so that makes for a very difficult communication situation. So we're going to talk about speech therapy treatment programs for Parkinson's. There are a lot of already established and very effective programs out there, and many more are being researched as we speak, and they all have their pros and cons. So I'm not here today to tell you that one program is better over the other. I'm just here to give you the overview of what is required to be able to participate in those programs. You can see here there's a long list of programs that are involved with speech therapy treatments for Parkinson's. So of course, LSVT, Loud, and Speak Out are ones that we are most familiar with, but there's also some traditional treatment, some traditional voice treatment that goes along with that. And you can see that those are listed there. Some therapeutic exercises. Here's another one, expiratory muscle strength training. Auditory feedback. This is a new one that I've seen out called Speech Vive. And I'm sure there are others out there. Visual feedback devices, compensatory tools or strategies, augmentative and alternative communication, and participation in leisure activities with care partners and family members. And of course, that's not everything that is available as a part of speech therapy for Parkinson's. These are just a few of the most common ones that I've seen and that I have experience with. So what is the goal of speech therapy relating to Parkinson's? So our goal of all of these treatment programs is to provide functional communication. And what that means is that we want our person to be able to communicate their message as easily and as physically efficient as possible. And in doing so, we have to decide what is the best method available to do that. Each technique that's out there has very different requirements that must be met for these programs to be effective. And we're going to go through that here in just a few minutes. So in talking about some speech therapy treatment programs for Parkinson's, we also have swallowing treatment and cognitive communication treatment that we have to consider as a part of a plan of care as well. So among all of these programs, there is a common theme, and we want to make sure as a part of a speech therapy program that we address all of them. So we want to address brain power, strength and coordination, movement, and knowing that we need to address all of these things, we know that they all involve some form of exercise. And we're going to talk a little bit about exercise as we go through the presentation. And I put exercise in quotes there because exercise is sort of a term that some of us don't like. I don't know too many of us that do like the word exercise. So we're going to talk a little bit about exercise here. So here's my friend here. He says exercise is good for health. And he obviously can't spell very well either. But when we think about exercise, sometimes this is what we think about exercise. So exercise is good for health, obviously, even though our friend here can't spell very well. But exercise is defined as a bodily activity that enhances or maintains physical fitness and overall health and wellness. It can aid growth and improve strength. It can prevent aging. It develops muscles in the cardiovascular system, and we know from previous presentations that our support group has had
No, I
live
agree.
setting.
But it's not
That
good to listen to.
those
I
cardiovascular
did something out of this. I thought she was going to talk about swallowing.
I'm getting some feedback from the background, so if everybody could please make sure you look at the bottom of left
Exercise your.
and make sure that your line is muted.
Mm.
So we're going to.
At least I got it all set
Joy,
up. So.
Joy, I'm sorry to interrupt.
Yes.
I'm going to mute everyone for just a second, so I'm going to take over as host again.
Okay.
Just 1 second. Sorry about that.
His voice was not bad at all.
Okay, all yours again. Joe, you're the host again. Feel free to unmute yourself. Thank you.
All right, so we know that exercise can develop muscles and address the cardiovascular system. And we know from previous presentations that our Live Parkinson's support group has participated in that cardiovascular exercise is very important for Parkinson's. It can also improve athletic skills. Not too many of us are out there trying to run a marathon or get a gold medal in the Olympics, but maybe there's a few of us out there who want to still work towards that, and exercise can improve those athletic skills. It can also help us lose or maintain weight. In the setting of Parkinson's, weight loss is probably not the best thing to undertake by yourself, but maintaining a healthy weight is very important. Exercise is also important for overall health and enjoyment. And I said earlier, not too many people enjoy exercise, but there are people out there who enjoy doing that. So here's a pro tip here at the bottom for you. If exercise doesn't appeal to you, then try calling it something else. Some people just don't like the word exercise. And so calling it something else can be particularly helpful in getting a little bit more motivation to do that. I can tell a sad story here. In one place that I used to work, when I used to work in a retirement community, the residents there, they hated coming to the exercise classes. They did not like any kind of exercise, physical fitness. So we decided we were just going to call the exercises what they were. So if they were coming to a class that presented Otego or other exercise programs, then we just called it Otego. Never used the word exercise. And after we did that, the participation in those activities increased tremendously just by changing the terminology. So it is very important to consider that for some people, terminology is very important. Words are so very important. And we want to make sure that we're using words that work and words that are helpful and motivating. So we say exercise is good for you. And really the biggest reason why exercise is good for you is because we know that form follows function. And what that means is that functional outcomes, which is a functional outcome is an improvement in muscle function that lets us to be able to do something better. So if it's that we have trouble standing up from a chair, then a functional outcome is that we did exercise and now we can stand up from the chair because the muscle function has improved. So what we want our bodies to be able to do comes from making the muscle group stronger and or more coordinated. And there's our example there about getting up from the chair. So I need to work the muscles that are involved in leaning forward, pushing my arms and legs to move my body into an upright position, working the muscles that control balance and the muscles that hold my body in that upright position. And that's our functional outcome, is to use all of those muscle functions to be able to get up from the chair. We never stop growing and changing, no matter how old or how young. And I will tell you, the oldest functional person that I've ever seen in my practice was 101 years old, and she was still up and buzzing around the hallways of the community where she lived. She did not use a walker or a cane, and she was actually still able to drive her car for a period of time that I knew her. She was actually a Pearl Harbor survivor, and she was a fascinating person, a wonderful story. So specifically, the benefits of exercise in Parkinson's is that exercise decreases the severity of the motor symptoms in Parkinson's. Our motor symptoms, slow movements, freezing, tremors, to name a few. And then exercise can also control the motor and non-motor symptoms alongside the use of medication. So non-motor symptoms, it's not all inclusive. And we know that the non-motor symptoms can include mood disorders, cognitive changes, fatigue, weight loss, and weight gain, just to name a few. So we want to know, how good is exercise? So there's our friend. We haven't seen him around in a while, Richard Simmons, but he's sweating to the oldies over there. And we want to know, how good is exercise? So exercise is only as good as if you do it. And so in my clinical practice, I can assign exercise programs till the cows come home. But if the person who's sitting in front of me doesn't do their homework, then the exercise is really going to be ineffective. Exercise is only as good as if it's the right thing for you. So I see people at the gym when the gym is open. I see people at the gym all the time doing all kinds of crazy stuff, and then they wonder why in the world they're not getting any better at what they're doing. Maybe that exercise is not exactly the right thing for them. And so exercise has to be tailored to your individual situation so that then it is the best thing for you and so that it is the most effective for you. Here's another pro tip for you. If you're taking physical, occupational, and speech therapy services currently, there should always, and then put always in capital letters there should always be a goal written for you to teach back your exercises so that you can do them on your own as soon as it's safe to do them. So every single one of my patients that I see, all 65, 70 of them, every single one of them has a goal for teach back. And what teach back means is that as the patient is able to give the information they have been taught, whether it's exercises or strategies or anything like that, to be able to verbalize or demonstrate that information back in their own words. And in doing so, that gives us as a provider a good measure for how effective that exercise program that we designed for you actually is and how safe it is. Because that is another important point. Exercises are only as good as if it's safe for you to do it. And so if it's something that you feel unsafe doing, you're not going to feel like you should do it at home, and therefore you're not going to do it. So you always want to make sure that the exercises that you undertake are safe for you to do as well. And without exercise, we always wonder, well, most of us know what happens without exercise, but it needs to be said that without exercise, the muscles get smaller in size, muscles lose their ability to contract, push, or pull, muscles work inefficiently, and what that means is that we need to consider how much energy does it take for a muscle to complete its work, and that the muscle can fatigue easily. Now, when we say how much energy does it take for a muscle to complete its work, what that means is that we want the muscle to be able to push or pull to its fullest extent and to its fullest range of motion with as much effort as it needs to, but without putting forth excessive effort. And so without exercise, our muscles run the risk of having to put forth that excessive effort, which then fatigues the muscle easily, which then means it doesn't work as well as it's supposed to or it should, which then also means that the rest of the muscles that support it also fatigue easily, and then eventually the entire body becomes affected by that. And so at this point, what does this have to do with speech therapy? We've talked a lot about muscles and movement and different things like that. And so now it's time to talk about what does it have to do with speech therapy. So we don't think about this a lot in speech therapy, but we use our muscles to breathe, swallow, and speak. And we use a lot of the same muscles in different intensities and combinations to breathe, swallow, and speak. And we need these muscles working well for a lot of important reasons. And so when I say the muscles for breathing, swallowing, and speaking, we're talking about the muscles of the head and neck, I don't know, I can't see myself, so I hope you all can see what I'm doing. So the muscles of the face, the neck, and also the muscles in our chest and down to our abdomen. We use all those muscles to breathe, swallow, and speak. What do the muscles for speech and swallowing do? So the muscles for speech and swallowing are very, very complex. They can be very complicated. And so I've tried to make this as easy as possible without making this sounding like an anatomy lesson. But the muscles in the mouth and the throat, which we're talking here, they all work together for three main reasons in this order. Number one, the muscles of the mouth and throat work together to maintain the airway, to help us breathe better. And they also help to maintain nutrition and hydration. That's for eating and swallowing. And for communication, that's for forming the words, projecting the voice, and making sure that our message that we're trying to communicate can be understood effectively. So we're going to talk about maintaining the airway. And this can get fairly complicated, so please stick with me. I'm sure that you all may have some questions about this at the end, and we will get to those questions towards the end of the presentation. So when we talk about maintaining the airway, we're talking about the muscles and structures of the face and the throat, on down to the neck, shoulders, back, trunk, abdomen, and truthfully, maybe even on further down the body. And all those muscles work together to determine the shape of the airway. So in doing so, these muscles, they help hold the airway open for breathing. They close the airway off during swallowing or swimming for that matter. They protect the windpipe in the lungs from foreign objects. So if you find yourself clearing your throat, it's allergy season, so we're all clearing our throat and coughing, or particularly when you're eating, if you find yourself clearing your throat and or coughing, then that's your protective reflex. That's what's happening. That's the muscles and structures in your windpipe and maybe even on down into your lungs trying to protect themselves. These muscles that maintain the airway, as they are impaired or impacted by Parkinson's, we are finding that they may even be closely related to pain throughout the body. We're going to talk a little bit about why that is here in a few minutes. So in talking about maintaining the airway, we have to talk about normal breathing and what that looks like. So normal breathing, it should feel really easy. It shouldn't feel very effortful at all. There should be no shortness of breath. It should feel really good. It should really even feel like something that would happen without you thinking about it. So there should be very little resistance when breathing. So there shouldn't be any noise. So when we say noise with breathing, we're talking about wheezing, or sometimes in the medical professions, you'll hear stridor, and that's another noise that happens when breathing, or congestion, or sometimes you hear people talking about rattling. That's another noise that happens when breathing. You may hear doctors talking about crackles and rails. And so those are other terms that we use to describe noise that we hear during breathing. And there should be none of that. There shouldn't even be a feeling of pushing to breathe in or out, because that's resistance in the airway. It's another form of resistance. So as I said, the breathing should be effortless and automatic and should not feel tired at the end of the day. And you should support appropriate speech volume and tone. So here's another pro tip for you. So sometimes problems with voice start with breathing patterns. And so for every evaluation of speech and swallowing relating to Parkinson's, there should be an evaluation of breathing as well. So that's very important to know those breathing patterns, because that is the basic, that is the number one thing that all of those structures do. So we need to know what they're doing at rest and when they're doing normal breathing before we can really know what they're doing with any kind of activity. So another word about normal breathing. So this is how it should happen. So normal breathing should happen through the nose. And the reason being because the nose, it actually heats the air up to 98.6 degrees as it goes into your body. So we hear about every winter, and this is why this is important. We hear about every winter that people in colder climates, way up north, Minnesota, Montana, North Dakota, it gets so cold up there in the winter that they start being told not to go outside because the air is too cold. It's because the air is so cold that their nose cannot heat that air up to 98.6 degrees fast enough as it comes into their lungs, and it can cause a thermal injury to their lungs. So it's important that breathing through the nose, it heats the air up to 98.6 degrees. It also kills bacteria. So anything that's floating around out there in the air, we want to make sure that our nose and the structures inside the nose handle that before it gets to the lungs and causes a challenge. For normal breathing as well, there's some things that have to happen inside the mouth as well. So the tongue is parked up behind the top front teeth with your teeth slightly apart and your tongue contained inside your teeth. And your lips have to be closed so there's no air escaping there. So I'm going to try to demonstrate as best I can what that should look like. So I'm going to be breathing through my nose. I'm going to have my tongue parked up behind my front teeth. My teeth are going to be slightly apart and my tongue should be contained inside my teeth. And my lips will be closed with no air escaping. So with that, I would love for you all who are watching to try that with me. So I'm going to close my mouth. My tongue is going to be parked up behind my front teeth. My teeth are going to be slightly apart. And my tongue will be contained inside my teeth. My lips are closed, so there's no air escaping outside of my lips, and all the air is coming in through my nose. And all the air is actually coming out through my nose. There's nothing escaping through my lips. So we want to see what you look like when you come for a speech therapy evaluation. And this is sort of what your profile on your face should look like. Your lips should be closed. You breathe in through your nose. You have a well-defined facial form, and those eyes are bright and alert. And that head is straight and up and looking straight ahead. And you can see that this person here in this picture is not breathing through their mouth at all. So I'm going to show you a picture now, or here in just a minute, of what abnormal breathing would look like. We've already talked about what it's like for normal breathing and what you should be doing. And so for one more time, I want you to try it. So I want everybody who's watching, close your lips. Your tongue goes up behind your front teeth. We don't want to push, and don't bite the sides of your tongue. And we want breathing through your nose. So if this was hard for you to do, or if you are noticing as we are talking through this presentation, if this is hard to do, then we want to talk to you about how we can get you breathing through your nose a little more effectively. So in talking about abnormal breathing, we have different forms of what we would consider to be abnormal breathing. So we talk about mouth breathing, noisy breathing, shortness of breath, and shallow breathing. These are all forms of abnormal breathing. There's probably other patterns out there that we would consider abnormal, but these are the most common that I see in my practice. So the number one problem to fix is mouth breathing. So breathing through the mouth is a real challenge for a lot of people. A lot of us do it. I find myself doing it sometimes too. So this is not the teacher pointing fingers. I find myself doing it too, and I've really had to work at this as I have come through my clinical practice in the years. Open mouth breathing, though, can cause difficulty in almost all other body systems. So it causes respiratory challenges, cardiac challenges, because it's making the body work harder than it has to. Head and neck posture is another challenge of open mouth breathing. Sitting, standing position also impact the position of the mouth for breathing. Open mouth breathing can also change the shape of the airway and the structures needed for safe swallowing and functional communication. So, as a side note there, that's what sometimes can cause speech to sound slurred. Sometimes it can make speech sound not very loud. Sometimes it can make speech sound a little too loud and tense. And then also, we have to consider sleep disordered breathing. So that sleep apnea, clenching and grinding of teeth that happens at night. And I say at night while you're sleeping, but sometimes those things actually happen during the daytime too. I catch myself doing it a lot, clenching my teeth as I'm not thinking about it and working along. And so we have to consider that as a challenge of mouth breathing as well. So this is what somebody who has abnormal breathing or mouth breathing would present to us like. So you can see that this particular person, their head is a little bit more forward and a little bit angled down. Their mouth is open. And so if this person was sitting in front of me, I would expect to see that their mouth being open. And that's where most of the air that's getting to the lungs is coming in through and going out from. And the eyes look really tired, and you can see that there is kind of a little bit of a darkness under those eyes. And we do see this quite a bit. People who have abnormal breathing sometimes do present in this way. So we want to talk about some consequences of mouth breathing. We know that mouth breathing can cause some muscle weakness in the TMJ. So that's that TMJ joint that sits right back here in front of the ears. It can cause some muscle weakness there, which in turn can then cause pain. And so if you've had TMJ pain, you know what that feels like and you know how uncomfortable that can be. It also can cause misalignment of the jaw and changing jaw shape. So that is something that can impact chewing as well as speech. Dry mouth, which is mainly just uncomfortable, but can also affect speech and chewing and swallowing. Possible sleep apnea. I put possible in capital letters because not everybody has sleep apnea, but that's a respiratory challenge that needs to be addressed. Possible snoring. So we all know somebody who snores, and that can be a consequence of mouth breathing. And I put that in capital letters because mouth breathing is not the only cause for why someone snores. But also that noisy breathing we talked about can also be a consequence of mouth breathing. Poor sensation, that means you can't feel what's going on in your mouth and in your throat and in the upper airway, which places a risk for choking. Drooling is another consequence of open mouth breathing. We also have increased risk for pneumonia because open mouth breathing doesn't give us the same filtration system that nose breathing does. And so all the bacteria, the dust, the pollen, the dirt, the whatever, pet dander, the whatever that's floating around out in the air around us gets a direct line through the mouth into the lungs. Whereas breathing through the nose tends to filter some of that out and help our body to get rid of it. Also, open mouth breathing can cause dental misalignment, and that's teeth problems. It can cause teeth decay, teeth misalignment, other problems relating to that. And then poor activity tolerance, which is a cardiovascular side effect of mouth breathing. So I'm going to talk just briefly about clenching and grinding teeth. And like I said, we all do it at some point, and we all have different reasons why we do it. Anxiety is one that I see. Concentration is one that I see. But muscle discoordination is another one that I've seen why people clench and grind their teeth. Clenching and grinding should not be a habit because it does hurt your teeth, and it also hurts the bone underneath your jaw and in that joint, that TMJ joint that sits back there. Clenching and grinding can also cause some damage with that, and clenching and grinding can give long-term problems, including pain, and could lead to extensive dental work down the road. So here's a thought on noisy breathing. Noisy breathing is caused by some form of resistance in the airway. So something is getting in the way. And if you think back to way back when we were in our science classes in school, our lungs are designed to take in oxygen and put out carbon dioxide. And so if there's something that's giving resistance in the airway, it may be something, it may be nothing, it's usually something, but that's going to cause that difficulty in moving air or exchanging air. And so we want to make sure that anytime there's noisy breathing, so if we're hearing that rattling or wheezing or crackling or railing or whatever noise, whatever word we're going to use to describe the noise of breathing, when we hear that, we want to make sure that we get that checked, because we want to make sure that we're not missing anything that's happening that we can't see here in the office. Shortness of breath is another form of abnormal breathing that we need to touch on. And according to the Mayo Clinic, shortness of breath is characterized by intense tightening in the chest. It's also characterized by air hunger, which is our brain telling us, breathe faster, I need more oxygen. So we start getting this pattern, and so that's the brain saying, need more oxygen, breathe faster. Difficulty breathing, where someone might feel like they can't catch their breath. Breathlessness, where someone may feel winded or out of breath. Or feeling of suffocation, where it feels like the air is being cut off. I see that somebody is raising their hand, and I apologize, I can't see who you are or what your question may be, but we will be answering questions at the end of the presentation. And so if you can put your question in the chat, if you can find that, we'll be more than happy to answer that question at the end of the presentation. And if you have questions and you can't find the chat, then please feel free to email me at the email address that I put up at the beginning, and I'll put that up again at the end for you as well. Shallow breathing is another form of abnormal breathing, and we want to touch on that because we want to make sure that we're not missing any muscle discoordination that is brought about by decreased range of motion in the diaphragm or discoordination in all of the respiratory muscles. There may be other causes too for shallow breathing, but when we breathe shallow, we're not getting good oxygenation, but we're also not always getting the carbon dioxide out to be able to allow for that air exchange. And so back to our kind of thoughts here on abnormal breathing. You can see that there are a lot of different markers for abnormal breathing. And if any of those sound like what you feel on a regular basis, then it could be a sign of muscle weakness or inefficiency or a structural abnormality. And we would want to make sure that that gets addressed for you. So here's a pro tip. When in doubt, have it checked out. Always see a doctor for new symptoms. We're going to talk about swallowing now. Is the second function of the airway that we want to make sure that we are addressing. Oops, and I'm so sorry, I just went backwards and I did not mean to. So we are going to talk about swallowing, and that swallowing should occur without really thinking about it. Swallowing is a highly coordinated activity involving many, many muscles, nerves, cartilage, bones, and physics. And we swallow over 1,000 times each day. Sometimes we swallow as much as 1 time each minute. So it's something that is very, very important that we do a lot of throughout the day, and we need to have it as highly coordinated, as strong, and as functioning as well as possible, so that we can make sure that as we swallow, that we're not having an adverse event as a result. So what happens when we swallow? We don't have to think about this too often. I have to think about it because I work with people who have difficulty swallowing, but in the normal population, we don't have to think about this too often. So there's really no way to accurately put into words all of the muscle functions of a normal swallow. It involves too many muscles and functions to list in detail, but what you need to know is that there is a certain sequence and pattern that our muscles would follow for an effective and functional swallow, and that it happens very quickly. And I'm going to show you in a minute what that actually looks like. So generally speaking, food must go from your plate to your stomach without aspiration. And aspiration is the medical term for when a foreign object enters into the airway. There's muscle movement in the mouth and throat that creates pressure to push food and liquid into the esophagus. And those muscles all reflexively close off the airway using a trap door. Breathing has to stop for a second in order for all of the foreign object or food and liquid to pass through. And then afterwards, all of those muscles and structures return to a normal position. So here is what a swallow would look like on an x-ray, or actually I believe this is a CT scan of some type. But you can see that we have different structures. And so the darkened areas, so the black areas on this picture are open space. So there's no structure there in those open spaces in the black areas. And you can see that there is some kind of gray areas, and those are structures and muscle. And then the bright white area right there in the middle, that's actually pineapple juice. So this person who has agreed to participate in this picture has agreed to swallow some pineapple juice. So I'm hoping that I can get this picture to play. But what you're going to see is the pineapple juice is going to move down through this open space and down into the esophagus. And this little trap door here is going to close off. And this is going to close off the windpipe. And the windpipe is right here in the front. And we don't want to see food and liquid going down through the windpipe. We only want to see it go down through this structure here, which is the esophagus. So here's a possible technical glitch. Let's cross fingers that this will actually play for you. So it's going to happen several times here. So you can see here, the trap door closes and the liquid passes by without entering into the airway. And then after it's over with, everything returns to normal. And it looks like nothing happened. So this is what a normal, functional, everyday run-of-the-mill, there is some terminology out there. It's not a medical term. It's called boringly normal. This is a boringly normal swallow. There's nothing to be concerned about for this person in this picture. But we do have signs and symptoms of difficulty swallowing that we look towards. And I'm not going to read them all off because we can all see that. But the main thing is that if we are having any of these challenges when we eat or drink, then these, or I should say, when we eat or drink, or after we eat or drink, then these are things that we need to be concerned about, because these are things that could be signs and symptoms of difficulty swallowing that we want to make sure that we are addressing so that we're not missing something underlying that could cause a bigger problem for you later on. This is not an all-inclusive list, by the way. There are many, many other things that become more individualized as we start talking about signs and symptoms of difficulty swallowing that we do note as we see them. But this is sort of just a general commonly seen list that floats around. And so swallow treatment. So there is a way if someone has difficulty swallowing that we treat that we rehabilitate those muscles to make them function more effectively. The main thing is that you always want to keep your doctor in the loop about signs and symptoms of difficulty swallowing. Start treatment with a speech therapist with the very first symptom. Difficulty swallowing, I'm putting this in here at the request of some of the members of our support group who actually were able to see this presentation live. We, as providers, as speech therapists, we want everybody to hear when we say that difficulty swallowing does not, and I capitalize that and underline that, does not always require an alternative means of feeding. And so this is a side note for alternative means of feeding, means a feeding tube. And that is not always our first line of defense when someone has difficulty swallowing. We want to engage in swallow treatment first to see that we can rehabilitate that so that we can make sure that we are doing everything we can to return to normal function as much as possible. There are certain circumstances where alternative means of feeding or a feeding tube is needed and necessary, and those situations are sort of individualized and they're very complex medical situations where we would make that decision. But generally speaking, difficulty swallowing does not always require a feeding tube to address it, and we do not always recommend that as the first line of defense from difficulty swallowing. So we're going to talk a word about pneumonia, because pneumonia is a very important part of difficulty swallowing, and it is a marker for difficulty swallowing. Pneumonia is always caused by a foreign object or a foreign something going into the airway and into a lung. It can be bacteria, fluids, dust, pollen, pet dander, mold, whatever it is that's floating out in the air can get into the lungs and could develop into pneumonia. Food and liquid can go into the lungs and cause pneumonia. And the take-home point with pneumonia is that it should be evaluated by a doctor very quickly, and it should be considered a medical emergency for someone with Parkinson's. So here's a pro tip. Recurrent pneumonia, 2 separate episodes of illnesses is what that's called. So 2 separate occurrences of pneumonia, or a chronic pneumonia, which stays with someone for 6 weeks or more. So either of those scenarios of no known cause. So if someone has 2 occurrences of pneumonia over a short period of time, so they had pneumonia, it cleared, and then they get pneumonia again, or a chronic pneumonia, which means that they have pneumonia that just doesn't go away, and it can't be related to a specific bacteria or a virus or another situation, then that should be evaluated by a speech therapist, because that could be another marker for difficulty swallowing. So chronic or recurrent pneumonia of no known cause needs to be evaluated by a speech therapist very quickly. So I'm going to show you here what pneumonia actually looks like. So we have the best way for us to identify pneumonia is through a chest x-ray. And so we've all had a chest x-ray for different things, different circumstances, and a chest x-ray can give us a lot of information about what's happening inside the body. So this is what a normal chest x-ray looks like. So if you've had a chest x-ray and you're standing in front of the machine and the examiner says, okay, I want you to hold your breath, and you get a good breath in, this is what it looks like whenever the picture comes out. So you can see down the middle, there are bony structures, and then you can see that those things that look like sort of arcs or arches, those are the ribs. And then all of the dark color is the inflated lungs. So this is a good chest x-ray. This chest x-ray is clear from any pneumonia. The heart looks like it's in a good place and it's a good size. So there's no concerns there as far as pneumonia goes. So this is what pneumonia would look like on a chest x-ray. So you can see very similar, those bony structures down the middle, and you can see the arcs of the ribs. And when this person was asked to hold their breath, this white area where you see the red arrows pointing, this is where pneumonia is. And so this is of concern because this is areas of the lungs that are not able to effectively take in oxygen to push out to the rest of the body. So we want to make sure that when we are evaluating someone, that we have that chest x-ray and that we know what it looks like, so that we know what to treat, we know what we're looking for, and we as speech therapists have particular markers that we are concerned with as well, and we look for on a chest x-ray. And so that's for us. We're not getting into that in this presentation today, but certainly if this pneumonia was of no known cause, we would want someone to evaluate this person for difficulty swallowing so that we could make sure we're not missing something that's underlying. Communication is the third function of the airway, of the structures of the mouth, throat, and on down the body. So communication is another something that we do when it occurs without us thinking about it. Maybe for some people it does. We know some people who are out there that maybe they communicate their message without thinking about it. And we're going to have a little bit more on this later. So communication, it's a highly coordinated activity involving muscles, nerves, cartilage, bones, and physics, much like swallowing. And the muscles in the mouth and airway move very fast to their full range of motion to a designated area to produce a desired sound. Humans can make over 500 different sounds with our mouth and throat and airway. And so we're actually gonna watch this happen here in just 1 second. But without good muscle function, as we've talked about all along, you can see where the muscles would be unable to move properly, and then we wouldn't be able to produce the desired sound for functional and intelligible or speech that can be understood effectively. So there's no way to accurately put into words all the muscles, nerves, and functions involved in producing intelligible speech. But speech pairs the lips, tongue, jaw position with the sound of voice to produce our message, very generally speaking. We also have to have another part to that we're going to talk about here in a few minutes. So I want you to say this phrase as you're watching. Say this phrase, zealous, wiggly-armed nylon shrimp. And that's a silly phrase that helps you to feel. I want you to feel what happens inside of your mouth when you say this sentence. Zealous, wiggly-armed nylon shrimp. So when we're talking about saying that phrase, the structures inside of the mouth, the lips, tongue, teeth, jaw, all the way on back, they have to move to their full range of motion to get that sentence out. And so if you're feeling what happens inside your mouth, it you should feel almost every bit of that. Zealous, wiggly-armed nylon shrimp. So I'm going to show you what that looks like when we're putting this on an x-ray or a CT scan. So you can see the darkened areas, just like what we saw on our swallowing CT scan. We can see that the darkened areas, that's open space. The part that's moving in the middle, that's the tongue, and that's moving to its full range of motion from front to back to produce those words. You can also see that the lip is moving to produce sound as well. And then down here, down towards the bottom, towards the windpipe, what you're seeing a little bit of contact there on the scan, and that's because that's where the voice is coming from. So the voice has to project all the way from here on up and out to here. Okay, so we're going to talk about cognition now. So there's a lot of cognition therapy that happens here in my office. So cognition, it pairs with communication for cognitive communication skills. And there is something to be said about cognitive communication skills in Parkinson's, because cognitive communication skills allow us to pay attention to communication partners. It allows us to plan and organize thoughts to formulate a message. We use language skills to put words together to make the words make sense. We use our cognitive communication skills to be able to respond appropriately to a communication partner. And we also engage in self-monitoring and self-correction. That's the part of our brain that says to us, did what we say make sense with the conversation? And that is something that we is built into our brain. It's hardwired. And so our brain is constantly supposed to be listening to what we say so that it can fix it if it doesn't come out the way we intended. So people coming into my office work on any combination of breathing, swallowing, speech, and cognition goals. So here's one of my favorites. I'm hoping this will actually be a video. So this is, I said this is my favorite client because, so this is my dog. His name is Snickers. And he's very cute. And we do speech therapy at home with my dog because he wants to talk. He thinks he's supposed to talk like we do. He thinks he's a person, and so he tries to talk to us. And so when he first came to live with us a couple of years ago, we decided that, or rather, let me say, I decided, my husband didn't participate in this decision, then he was going to be a little bit conversational. And so what happens sometimes at home is that we have little conversations, and I make him use his voice, and he listens to what I say, and then he responds. I'm not sure about the self-monitoring and self-correction part because I'm not completely convinced he knows what he's saying, but maybe he does. I don't know. You be the judge after you see this video. So I say he's one of my favorite clients because he's probably the most attentive that I have, and he participates the best that I have sometimes. So we are going to watch this video here, and you're going to see all of this in action. So he needs to communicate a message to me. His message, I think this video is that his message is that he wants to eat a slice of cheesecake because that's what he thinks he's supposed to do. So his message is that he wants to eat a slice of cheesecake, and he's going to tell me that in this video. And then he's going to be a little bit conversational with me about why he is not able to have cheesecake. And so here is our speech therapy session at home.
No cheesecake. No cheesecake. All gone. Mommy ate it.
And so that is an example of how all of those skills, albeit it's in my dog, that is an example of how all of those skills go together to work to communicate our message. So we need to talk about what is the most effective exercise. So in general, but also for speech therapy, the most effective exercise is individualized. So there is not one set of exercises that I give to someone who comes into my office who would say that this is the only exercise, and there's not, and the only exercise that they do, and that it's cookie cutter across the board. So everybody gets individualized exercise. So it's the exercise that they need to challenge the muscle groups or brain functions that need work. And those exercises need to be instructed well enough that you can do them on your own at home with help if needed. And there's also compensations to the exercise to get the maximal benefit. So not everybody can do the exercises in the same way. So we have to teach ways to get around it so that we can make sure that the exercises are the most beneficial that they can be. When is the right time to start speech therapy? And so this is a question that I get asked a lot in relation to Parkinson's. And truthfully, there's never a wrong time to start a speech therapy treatment program for exercise. The neurologists are never opposed to referring if it's necessary. Prevention is the key, and the proactive approach is the best approach. And progress in treatment, particularly for Parkinson's, may involve maintenance of a current level of function. We need to talk about what insurance covers because this is an important part of therapy services. So most people have Medicare Part B, which covers speech therapy based on medical necessity. Speech therapy should not be offered or withheld based on what Medicare says or if you're out of money. I hear this sometimes from time to time that somebody will come to see me here at the office and they'll say, well, Medicare said I couldn't have any more because I'm out of money. Or Medicare said blah, 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 blah. There's a lot of interpretation of what the Medicare guidelines actually are for speech therapy. So I'm going to share with you my opinion on that in the next slides. Generally speaking, though, Medicare covers 80% of any therapy services that are provided, with 20% covered by secondary insurance if someone has it, with the understanding that there may be copays and deductibles involved with the secondary insurance. So it's important to know your insurance plan. And so we're going to talk about the Gemmo versus Sebelius case. And this is where I get most of my interpretation of what the Medicare guidelines are in relation to Parkinson's. And so this case was sort of a landmark case in the rehabilitation professions a few years ago. In this case, it's a lawsuit that this patient named Gemmo, that's the patient's last name, filed this lawsuit. His family filed it on his behalf that alleged that Medicare was denying physical, occupational, and or speech therapy services based on progress or lack of progress towards goals. The outcome of that case was that Medicare cannot deny beneficiaries therapy services based on lack of progress. Therapy services can be provided as long as it's considered a skilled service. So what that means is that in some cases, a beneficiary of Medicare may not be making progress towards their goals at a particular point in time, but they might still require a treatment program that can only be provided by a licensed professional, PTOT or speech therapist, to maintain their status and prevent further functional decline. So in the next couple of slides, I'm going to give you an example here. So one of the groups of people that I serve are people who have muscle restriction in the mouth, throat, and airway. So people with this type of muscle restriction require speech therapy services to retain and retrain muscle function for improved breathing, swallowing, and speech. And while the exercises are repetitive, the exercises are designed to stretch muscles and improve range of motion. A speech therapist provides this service because it would be unsafe for someone to manage this at home completely independently. So what this means, this is not a permanent ticket for indefinite therapy services. It just means that a beneficiary can receive a necessary service if it is determined to be unsafe or impossible to complete it outside of the boundaries of a treatment session. So in talking about what your insurance covers, so private insurances do cover speech therapy as well. It's very important as a consumer that you would know your benefits, and it's very important to check with your insurance to review your coverage. Speech therapy is not a blanket statement, so it depends on the issue at hand. So in some insurance plans that I have seen recently, speech therapy for communication may not be covered, but swallowing therapy is covered. Some insurance plans will say that swallowing therapy is not covered, but speech therapy services are covered. It is really up to the insurance plan as to how that is determined. And so it is very important that you would know what your insurance plan covers and what conditions it's covered under. And this pro tip here at the bottom is something that's very, very important that we feel like that everybody should know, is that just because your doctor says that you need to do speech therapy and he's willing to write a prescription, he or she is willing to write a prescription that says so, that does not require your insurance to cover it. And so we feel like it's very important for you to stay on top of your insurance plan to know what the conditions and what coverage is out there for you, so that you can be an informed consumer of your insurance plan and not be caught off guard by something that you didn't know. So this last part of the presentation, I'm going to talk about how I became everyone's favorite speech therapist. So that's kind of a running joke here around our office here at Carolina Health and Hearing. And first off, because I'm the only speech therapist that works here in this office, so by default, I am everyone's favorite speech therapist. But I do serve different unique groups of people who might actually would vouch for that. So full disclosure, that is 100% true for several people in my professional life for various reasons. And you're going to get to hear some of them here. Many people, well, and one particular person did tell me, of all of my doctor's appointments, this is my favorite one. I never asked him why. Be interesting to find out why. He'll be back in here in a few weeks after the COVID-19 is over. So it'll be interesting to find out why he may have said that. I had another person to tell me, well, not everyone can be perfect. I don't consider myself to be perfect. I'm very flattered that someone would actually think of me that way. It's fun. I did get to have a little fun with that statement though. But people keep coming back to see me, so I suppose there's a good reason for it. And a couple of other little taglines and quotes. So just as a side note, I don't have this high of an opinion of myself, but for some people who come to see me, I do have to act like I do. And so I was recently told by somebody who comes into my office, when I showed this slide to him, he said, you should trademark that so no one else will say it. So that's my little trademark up there in the corner, because I guess I am his favorite speech therapist. Maybe that's what he wanted me to know. And then just today, I actually showed this slide to someone who was in my office right before this presentation. And his statement was, I just want to do well enough to get a quote in your presentation. So sometimes we have a little goofball moment. So he was proud that he did well enough today that he could get the quote in the presentation. So I do have some rules here in my office for being everyone's favorite speech therapist. And these are my personal rules that I follow. And because I follow these as my personal rules, the people who come to see me in my office, they eventually start to follow these rules too. And that's when everything gets to be a lot of fun in my world. So my first rule says that there's power in looking silly and knowing that you do, and that's from the actress Amy Poehler. So I have great silly stories that I save up just to make people laugh, and I promise these stories don't disappoint. But I really feel like laughter is the best medicine sometimes. And so I have no shame in telling about something silly I did or tried to do that didn't work out, because I think it makes me human. And it lets everyone who comes into my office know that I struggle with things just like they do. And so I have no shame in laughing at something that I did, and especially if I need to break the ice a little bit. So here's my second rule. My second rule says, and I actually have this posted. I don't think y'all can see behind me because I have my New York background, but what I have posted behind me, it says, let the light that shines in you be brighter than the light that shines on you. And that's from my favorite football coach, from Dabo Sweeney. So what I take that to mean and apply it into my practice is that I don't do any of the hard work of therapy. The person who's receiving the therapy does all the hard work. I did have somebody, when I showed this slide to somebody yesterday, they said, but you make sure we do the hard work. So that lets me know I'm doing my job if they're able to tell me, you're making sure we're doing the hard work. But really, I'm just a bystander in someone else's success story. I don't need to take credit for someone else's success. I always say your story's not my story. And I actually have posted here on my wall about how I just get to stand in the background while someone else gets to take the credit for all their hard work. So I also have a rule in this office. This one's not posted, but everyone here knows it. Another rule I have is to love everyone well. We don't go by labels in this office. And the reason being because everybody has very necessary personal goals to meet. And we say them out loud, and often, if we can, so we remember to fight hard for it. And so with that, I don't usually call somebody by their diagnosis. I call you by name, and we talk about your goal, and that's how we know what we're doing, is because we talk about goals. We celebrate the good stuff, but we work through the hard stuff. We laugh and cry, sometimes at the same time. Had that happen yesterday. Sometimes we even argue. And actually, for a good number of people coming through this office, I have a goal that says that they will state their opinion to me and that they will try to convince me of what their opinion is. So we do argue. And it's a goal, and I like it. And it's just as much a brain exercise for me as for the person who is working through that challenge. And we fail forward. So all I ask in my office is for someone to give their best. I do put the disclaimer out to everybody who comes through. So we do have to struggle a little bit, and I do push to a limit. But in doing so, we figure out what didn't work so that we can do it better the next time, or we can do it different the next time so that we can make it easier for the next time. And that's how we operate. We operate on how to make things better, different, or easier. And so I say those things, but I also want you to know that I really don't think that everything is all about me. It's really not. I want you to know that these aren't the goals that I set for people. These are the goals that the people set for me. I have a specific group of people that come through here that have very high expectations for me, and so those are the goals they set. And so those are the things that I have to make sure that I do to make sure that they meet their goals. And so what I want you to know is that these are the keys for you finding your own favorite speech therapist. And so in looking for if you're looking for a speech therapist out there, those are the things that I feel are the most important for you to be looking for to find out what's going to work the best for you. And so as with the end of every professional presentation that I've been to lately, it always ends with a picture of the pet. So this is the same little guy you saw in the video talking about cheesecake. And yes, he is wearing a sweater. Everybody who sees that picture says, I can't believe he's wearing a sweater. He is wearing a sweater in the picture. His name is Snickers because his markings are just like the Snickers candy bar. And he's very cute, and he is a talker, and he wants to walk like people, and he wants to do everything just like people do. So I appreciate you all listening in today. I'm going to come off the presentation now, and I'm going to see if I can get to the chat to see if there are any questions. And I don't see any questions here. And so if there are not any questions, I'm going to flip back. And I'm going to leave the information on the screen for my contact information, so that if for whatever reason you wish to contact me to ask questions or to be able to reach out and share thoughts or give us a call, or if you need help in finding your own favorite speech therapist, we're happy to do that as well. So that concludes the presentation. I will be here for a few minutes to answer any questions that may come up. But again, please feel free to email us or call us. thank you so much for listening, and I will look forward to seeing you all on future presentations. You'll want to watch your email if you are on our email list to make sure that you are getting communication from us about upcoming presentations. And please make sure also that you watch your email for the survey that's coming. So if you're on the live presentation today, you will be getting a survey about how easy it was to use the Zoom platform, how easy it was for you to log in, how well you could hear us, see us, and that sort of thing. So you'll want to make sure that you get that information. So I'm going to leave this here for a few minutes, and I'll stay on for a few minutes so that you can ask questions if you have something, and we'll then convene again at another time, and we'll look forward to seeing you all soon.
Thank you, Joy. Really appreciate the presentation. Thanks for all the information. You did a wonderful job.
Thank
And
you.
thanks to everyone who attended. Like Joy mentioned, this was our first time putting something together on behalf of the Parkinson support group. So we look forward to doing this more often. And I just want to thank you all again for being a part of this first webinar.